I'm Kathy Matt. I'm Dean of the College of Health Sciences at University of Delaware, and I'm Executive Director for the Delaware Health Science Alliance. And I want to tell you about the amazing story of the STAR campus. In 2009, the university bought the former Chrysler site, a car assembly plant, 272 acres. And over the last 4 years, that acreage has been transformed. As that decommissioning took place, a decision was made to retain a part of the site, and we are in the process of remaking it into part of the College of Health Sciences complex. So you come into the building and immediately you're welcomed by very large open spaces. You look up and what you see are sort of industrial rafters, which are reminiscent and are remaining pieces from the former Chrysler site. And then if we go down the hallway just a little bit further on the left-hand side, you will see a very, very interesting mural. The mural is a painting of the cars that came across the assembly line at the Chrysler site. We specifically protected this and kept this mural so that we could, in fact, be able to show this as a part of the building. So in terms of the programs that are there, one of the first things that we needed to do was really to move the clinics that we have in the college to a place that was much more accessible to the community. So the physical therapy program that's in our college, that's second in the country, is moving to clinics that will be there. What happens in these clinical spaces is that our physical therapy students obviously learn in classrooms, but they also learn a large amount of what they do through their clinical interactions with patients. So we run sports clinics here, we run neurological clinics, we have a stroke clinic as well. And so there are spaces designed all within this clinic for the students to study, to take notes, but at the same time to interact with patients. We also have a nurse-managed health center in which our nurse practitioners and our nursing students, as well as people from our kinesiology program and our nutrition program and our athletic training program, medical lab sciences, and our behavioral health programs all interact with that nurse-managed health center, because the model of how that nurse-managed health center works is it delivers primary care in conjunction with programs that are targeted for prevention and wellness. So as you walk into the clinic, you will see a beautiful waiting area where people can sit and be comfortable. You have individual treatment rooms where nurse practitioners will be meeting with patients. And so the other things that are also included in this space are some of the research pieces as well. We have interview spaces where individuals can actually sit, whether it's a health coach or a behavioral therapist or a nutritionist, to talk to patients and help them design a plan. And then in addition, for some of our research studies, we also have a sample processing place. So if individuals agree that they are willing to be a part of a research study, then we can take blood samples or saliva samples and look at some of the latest biomarkers that help us to detect disease. So there are 3 conference rooms that are set up completely with state-of-the-art video conferencing capabilities. This is for us to carry on video conferencing that we will utilize for many of our research grants where we have collaborators across the country, but also very importantly, it is to connect all of our members of the Delaware Health Science Alliance. You will also see a very large and welcoming area or atrium that is actually home for our community members who come in to visit our clinics and to be involved in our research studies. This is also a space that we will use for large events that we want to do. So there is a screen that can drop down and we can do seminars and presentations in these areas. We also have in the back bay areas where the cars were assembled, we've actually taken those spaces and transformed it into large research spaces that allow embedded treadmills to be put into place, allow large areas so that we can do some things in terms of looking at movement and movement science and really being able to measure those movements with very sophisticated equipment. And on the second floor, we also have a series of offices for our faculty, our staff, our clinicians, all involved in teaching and research. But what you see right next to their offices is large spaces and areas for students. So one of the real intentional things that we are doing in this building is creating spaces and opportunities for all levels of individuals engaged in research and education to interact. In one area you'll see the plinth lab, which is where our students learn to do physical exams and how they learn to do treatment programs. So they can learn about those things up here, and then they just go downstairs and practice the things they've learned in the clinic with real patients. Then the next room, what you'll see, it's set up in a very different fashion. It's all set up for interaction. It's for hands-on learning. So what we bring to the students are real-world challenges and problems and clinical examples, and they work together in groups. These spaces that we're creating in this building will really take our programs to new levels, because we are really doing the most innovative designs that we can do to foster education. So the signature for the STAR campus, and I think the one statement that really sums it up, is about inspiration plus innovation is about and leads to impact. And that's really sums up what we are trying to create on the STAR campus.